Now, in March 2020, the then Prime Minister Boris Johnson announced the first UK-wide coronavirus lockdown. 5 years, 6 months later, for many of us, it seems like it's 100 years ago. And the Office for National Statistics has estimated that more than 44 million people in the UK had the virus between April 2020 and February 2022. It's just extraordinary. Many of us fully recovered and have not had any further impact. But there are some who have COVID-19 in their lives still because they have this thing called long COVID. Now, that is characterized as a group of symptoms that persist and develop after the original infection. They can include extreme fatigue, breathlessness, muscle weakness. And if you have them for more than 12 weeks after initial infection, you call it long COVID. The ONS found that as of March last year, long COVID symptoms adversely affected the day-to-day activities of 1.5 million people in the UK. So are you one? Are you still struggling with long COVID? Are you thinking, my God, the nightmare continues. Everyone else is out of lockdown. I'm still in it. Text us 88291. You can email vine@bbc.co.uk and please send us your phone number when you email so we can get you on air. We'll talk in a moment to Dr. Sarah Jarvis, but first let's go to Jess Marchbank, who suffers still. I'm sorry to hear, Jess.
Yeah, that's sadly right, yeah.
And you were infected right at the start as well.
Yeah, I was one of the first people in North Devon to be tested positive and to be admitted to the local hospital, yeah.
Can you tell us a bit more about what you were doing then?
Well, I was a health visitor, so I was a specialist public health nurse and contracted COVID. And yeah, since then, that's 5.5 years ago, I've sort of been a shell of myself, and yeah.
I'm really sorry to hear it. It's a nightmare, and of course, there are many other people in the same position. Just tell us then. So the first big lockdown was March 2020. Were you already infected by then?
Yeah, so I actually was admitted to the hospital on the Friday, and then I think we locked down on the Monday. So I was sick just before everything was shut down.
And in terms of your health up until that point, I gather you were in your 30s and you were fit and healthy.
Yeah, fit and healthy, in the gym all the time. No previous medical conditions. How
ill did you get when you actually had COVID initially?
Well, because we were told originally by lovely Boris that those affected, my age group, wouldn't be affected. It was sort of the old and the vulnerable people. I didn't really understand why I felt so poorly. But yeah, I was really unwell. I sort of felt like I'd been hit on the head with a cracking headache, and then was in bed for sort of 48 hours with muscle. It was the worst pain. It was much worse than any sort of labour pains. And then my breathing was impacted sort of 2-3 days after that. And then I was taken into hospital and put on lots of oxygen and things like that.
Right. So you were very, very poorly. And
yes.
At some point, I'm guessing you thought, OK, the worst is behind me, did you?
Oh, yeah. As soon as I was released home and I was brought home in an ambulance, I thought, that's it. I've done it. I'll have my own immunity now. Everything will be great. And then it was sort of about 4 weeks later, it felt like someone had instantly filled me with cement, and I didn't move.
And you're still in that same feeling, are you?
Yeah, still
really?
Very much. Yeah. And it's been 5.5 years.
Wow.
I mean, the past 4 weeks, I found a new medication, which is helping me a lot, but I'm, still very prone to relapsing and getting big flare-ups and lots of pain and things.
Should we bring in our brilliant doctor to have a think about this? Sarah, I know you're very aware of this long COVID condition.
Oh, yeah. I'm all too aware of it. Interestingly, you made the point about 1.5 million people, but actually a study by Southampton University earlier this year looked at over 750,000 people who responded to the GP survey, the GP patient survey, and they estimate it may be as many as 5%, so 1 in 20 people in the UK who say they've got it, and up to 1 in 11 who think they might have it but aren't quite certain. But of course, the problem is the symptoms are so wide, so debilitating, debilitating, varies so much from person to person. And indeed, there's so much stigma about it, just get on with it. Surely it's all over. We put the pandemic behind us, that I think, we've still got a lot of people who almost certainly have got symptoms, but just, aren't certain yet.
Okay, listening to Jess speaking about how she feels like she's encased in concrete, can you guess at what's happening inside her body?
Well, part of the problem is we don't exactly know what's happening with long COVID, and there is still a lot of research going on to it. We think probably either people who've got long COVID never fully clear the virus from their systems, or that they get a dysfunctional immune response. Now, Jeremy, you and I have spoken so many times over the years about, autoimmune disease, where your immune system basically goes rogue. And we have got examples of this. So, for instance, the 1918, the Spanish flu pandemic, which killed far more people than World War I, we know that seemed to trigger a really intense response from the immune system called a cytokine storm, where we got immune cells, inflammatory molecules, all these things being released. And we think that basically it's entirely possible that people who have long COVID, their immune system has just gone rogue.
Does that make sense to you, Jess?
Yes, it does. And I've done a lot of research myself, as has my mother, who has not stopped fighting to find a cure. And it's all in your mitochondria cells. It's the spike protein and your T cells. So it's from the cells up. So, yeah.
And so they always say the mitochondria are the sort of battery packs inside the cell.
Yeah.
And that's, once they start to go down, Sarah, then the fatigue is deadly.
Yeah, and we do know, of course, that fatigue is the single commonest symptom. So, some people, after they've done exercise, they'll just be completely wiped out. Their symptoms may get much worse. They may have fever, pain, but then you've got all the other symptoms as well. But certainly the single most commonly reported symptom is tiredness. And anyone who suffers with ME, we know that, they have exactly the same thing. The big symptom is tiredness. It's bone wearing. It's just absolutely not the kind of tiredness that a good night's sleep will get over. And the problem is that if you do have a relatively good day, or shall we say a less bad day, and try to get back to normal, then you can pay the price.
Well, Jess, what are you doing at the moment then to just stay steady?
I think the big thing for me is my family and my church. So I'm part of a local church called Home Church Bideford, and without them and my faith, I honestly don't think I would be here. So I think that's the main thing for me.
What about I'm not taking away from the church, but what about the medication that you say you found?
Yeah, so I've been looking into sort of something called mast cell activation syndrome. There's a lady called Dr. Tina Piers, who I would recommend anyone with long COVID to go and have a look at. She's an NHS doctor who's going private to help people with long COVID. And she's sort of recommending like a H1 and a H2 blocker, so antihistamines to fight these cytokine storms that your doctor was talking about. And that has really helped me. So it's just a normal antihistamine you can buy over the counter, and then one that your GP has to prescribe. But that has been amazing. And also something called low-dose naltrexone, which you can get from a Glasgow company, which really helps with the inflammation and the pain.
Right.
And that's been wonderful.
Okay, and presumably you've met people, or even just online, who've got this exactly the same. So this is not all in the mind or anything like that. It's a real thing for lots of people.
Yeah, completely. And, your doctor's talking about, when you do exercise, you have a flare up, and it's not even like exercise is walking up the stairs or chopping an onion. And, it's the most minute task will make me have to lie down for 20 minutes or have a 2-hour nap. And she's right, the tiredness it needs to be a bigger word than tiredness. It's the most excruciating pain level of tiredness. And it's indescribable.
Thank you so much for talking to us. And we really hope you find the way out.
Thank you.
Yeah, thank you. Jess Marchbank suffers from long COVID after becoming infected in 2020. Of course, at the time of COVID, the whole thing was causing death and destruction, Sarah. And so long COVID was sort of a little bit down table, wasn't it, as a subject?
Yes, it absolutely was. But of course, as more people who'd survived it were coming out, we began to understand there were several different types of long COVID, so-called different syndromes. So, for instance, people who'd ended up in ICU, we know that people who've been in ICU, they need to learn to, sometimes to sit up, to eat, to walk, to talk, to do everything again. And their muscles and their whole bodies have been so devastated by it. Then we've got the sort of post-viral fatigue syndrome, where again, we don't know whether you've just not cleared it or if it's your immune response. And then there's permanent organ damage. So, as more people got it, more people living with the consequences. What's really interesting is you didn't have to have really severe long COVID to get, severe COVID symptoms to get long COVID. Jess obviously was very badly affected, but some people had relatively mild COVID symptoms and were then really, really severely affected. But she is absolutely, in so many respects, in the risk category. So people sort of mid-30s to late 60s, females, people working in more deprived areas, people working in social care, probably because they got exposed to more virus, and people with other activity-limiting health conditions. So, she ticks so many of those boxes, bless her.
Thank you. We're talking about long COVID with Dr. Sarah Jarvis. We will have some more music and then we'll talk to more people suffering with it, living with it. And in Penrith, I know you've got a almost similar story about this long COVID affecting you.
Yes. Hello. Thanks for having me on.
Not at all. Tell us what happened.
So we were, it was October 2021. Myself and my husband, we were both infected at the same time, and it just destroyed our health. And I think when we were infected and we were both very badly impacted by it, at that time, I remember thinking, where were the warnings? Where were the warnings for what was going to happen to us? Because I think I expected, because I was 39, very healthy, busy mum of two, and based on, the public health advice at the time, assumed that I would probably be okay, because obviously the narrative was always about either, basically if you would die or not. There was never any information in the public domain about morbidity, about the long-term impact on health. And so, naively, I know now, I just went about my life and, contracted COVID, and that was it. We were both hit very, very differently. So if we hadn't both been affected at the same time and both, known what caused it, we would never have known that we had the same thing wrong with us, because my symptoms were so different to my husband's. I was unable to walk. I was unable to sit up for any period of time. I would black out, and his symptoms were neuropathy. His skin was burning. He had numbness. Were some symptoms that we had that were the same. But yeah, it affected us. It affected us both very differently.
Horrible. Again, so when you heard Jess speaking, were you thinking that's the same as me, or were you thinking, no, it's a different cluster of symptoms in a way?
Well, but then obviously, I know I reluctantly had to find out a lot of information about long COVID, so I don't expect, when I speak to somebody else who is experiencing long COVID, I don't expect, to have the same, for it to have affected me in the same way that it's affected them. There's over 200 symptoms that you can experience. So I know that it's, the symptoms are varied, and also, things that would work for one person to help them and improve their symptoms won't necessarily work for somebody else. So I found things that helped me, and my husband did exactly the same things, and they didn't have any effect on his symptoms. So it's just, it hits people really differently.
Sarah, over to you.
Yeah, you're absolutely right, Anne. I'm so sorry, and I'm so sorry you've both really struggled with this. I really hope you're getting the help now, because as you so rightly say, this needs personal help. So, even the most common symptom, this profound, this bone-crushing tiredness, fatigue, about 2 in 3 people get it, which means about 1 in 3 doesn't. Shortness of breath is about 2 in 5 people. Problems concentrating, about 1 in 3 people. Muscle aches, slightly less than that, about 3 in 10 people. So if you then think about what we need is personal help. Now, there are now post-COVID services, and if you go onto the NHS website and have a look at long COVID, then you can go down there. And that'll give you a link to somewhere that you can look and see if there are post-COVID services in your part of the country. There are it's probably worth pointing out, there are post-COVID services for children as well, because young people can get it too. But it's really about, firstly, learning to manage the symptoms yourself, recognizing this is very, very real, and that, you are going to have to develop a new normal. And I think I really want people to understand you may not be talking about getting back to normal, certainly not for many, many years, but there are new normals and there is hope in that respect. But if you really are struggling, then please, please speak to your GP, because there are still long COVID services or post-COVID services, and the point about them is they're providing a sort of personalised service. So they're looking at what you need. Do you need mental health services? We know that it can affect your mental health hugely. Probably the condition directly can affect it, but also being so unwell for so long and seeing no way out can really trigger anxiety and depression. Do you need a sort of specialist integrated service which can look at how you can manage your life? Breathing pattern retraining, occupational health to make adaptations at home or at work, all those sort of things.
Gosh, okay, thank you, Anne. It's big, isn't it? Aveline in Cheshire, hello.
Hi, Jeremy.
Oh, you're only 16 and you've had 4 years with it.
Yeah, so I also got it in October 2021 when I was 12.
Oh, so it's a quarter of your life, and that's really painful. Are you getting any better, Aveline?
No. It's been 4 years now, and there was a bit of hope at the start, when it's all fresh and new, but as you get further into it and you try more things and they don't work, it's a bit disheartening.
Oh, Sarah, is there anything you could say to Aveline?
Oh, Aveline, I'm so, so sorry. Honestly, isn't it interesting that I just the second before you came on, without knowing you were coming on, said there are children's services, there are young people's services, because young people can get this too. And as Jeremy says, a quarter of your life is a very, very long time. Are you under a specialist service?
Yes, I am.
Okay. Well, that's the best you can offer. The good news is that this is still very new. It may feel like a very long time ago. For many of us, we kind of feel, long COVID 2020, gosh, that's 5.5 years, that's half a lifetime away. But actually, we are still discovering more. So just because they haven't got the right solutions for you now doesn't mean they won't get them, because it's still a very new condition. Long COVID has only been around for 4.5 years, so there is still much that is being learned. They are building on some of the learning that's previously been done with ME, and I'm hoping they're not going to make the same mistakes. There have been some issues with ME, with people not being recognised. So I really, really hope that you can continue to work with your service. The only thing I will say is we are seeing people getting better. I'm seeing people in my clinic getting better after 4 or 5 years.
All
so
right.
It doesn't mean it'll be there forever.
That's something. I really hope it comes through for you, Aveline. How's your schooling at the moment?
I had to stop public school in year 10 because I became so ill that I couldn't attend, and I had to start homeschooling. But since then, I've still managed to work towards a few GCSEs, not at the same rate as everyone else, but I was working with what I had.
Oh, listen, you're very... People say brave, and then it's, I know it's not always the right word, but full of admiration, and I hope one day you look back and it's just a painful memory and it's not forever. Aveline, thank you.
Thank you.
Oh, all right. Well, Sarah, that's the call to end on, isn't it?
It is the call to end on, but it is a reminder that, in the great scheme of things, this is still very new and we are learning more, and there are things that, are just around the corner. There's still research going on to find out what exactly is happening with the virus, what's causing it. There's one research looking at whether, for instance, small fragments of the virus are persisting in their bodies. Well, if we can do that, then it may be that we can look, for instance, at so some kind of monoclonal antibody, some kind of immune therapy, which will effectively override that overactivity of the immune system. Who knows?
Thank you very much indeed. Dr. Sarah Jarvis on Medical Monday talking about long COVID.